at noon. Please don't go away, don't turn off your videos or anything, because we are going to have a very special activities during the lunchtime, waiting for the grand closing ceremony at 1 o'clock. So please stay tuned with us after the end of this session. So as for now, I think it's the time that I'd like to transfer to Dr. Domlin for your very interesting sessions. Please, Dr. Domlin.
So officially, it's 10:45 Bangkok time, and we are in the Philippines, and it's 11:45 in the morning in the Philippines. So we will start this symposium 13 on smoke-free cities, leading the way to a tobacco-free future. So welcome everyone to the 13th Asia Pacific Conference on Tobacco Health. Um, we will be starting this symposium 13 with a video. Okay, sorry, I have to unmute myself. Good day, everyone. I am Dr. Domelin Villares, your moderator for this morning's symposium. And together with me today, so let me introduce to you my co-moderator for this symposium, Um, so there you can see me now. All right. So let's welcome and let me introduce to you my co-moderator for this symposium. He is a Doctor of Medicine and Surgery. He finished his studies on Bachelor of Science, major in Biology, accelerated class, and Doctor of Medicine and Surgery at the University of Santa Tomas in Manila, Philippines, and his Master in Development Management from the Asian Institute of Management. His areas of interest are in development management in health, and clinical medical service through professional and volunteer work. Currently, he is the Assistant Director and the Head of the Health Division Human Development Directorate, ASEAN Socio-Cultural Community Department in the ASEAN Secretariat, Jakarta, Indonesia. Please welcome my co-moderator for this symposium, Dr. Fernando. Sorry. Hi,
Thank
Dr.
you.
Ferdy.
Hello. Thank you, Dr. Doms. Thank you for the kind words. Good day to all of you. I hope that all of you are still doing well and doing good in spite of the challenges we are currently experiencing. Definitely, it is my pleasure to be part of the symposium since our current health program priorities in the ASEAN region has interest in the Smoke-Free Cities campaign. And a great way to start off this symposium is through a video presentation to introduce this Smoke-Free Cities campaign, which was already presented very well through a well-done video. For Symposium 13, there are 5 distinguished speakers who will be sharing information and empowering presentations or lectures from which we will gain much insights. And I hope that all of you who are participants to this symposium will really gain a lot of lessons learned and a lot of exchanges so that our experiences will be more enriched. Thank you very much for the warm welcome. Over to you, Dr. Doms.
Thank you very much, Dr. Ferdy. So the objectives of this symposium are as follows: to learn the best practices of the smoke-free cities with advanced policies and enforcement practices in the Asia Pacific. I think today these are the cities more of the ASEAN region. And to encourage participants to strengthen their smoke-free laws and their implementation, and to adopt the smoke-free meter, which will be introduced later today as a guide engaged in making the city smoke-free, and to engage more cities, municipalities, provinces, states, and regions to join the Smoke-Free Cities Asia Pacific Network. Doc Ferds?
Yes, indeed. At the end of this symposium, it is expected that the participants will be able to share the experiences of different sectors in government and civil society organizations as part of their contribution in making cities smoke-free in their respective countries, and be able to encourage their cities to join the campaign and be part of the smoke-free network. Without further ado, let me introduce this first speaker. She is a Doctor of Medicine and has finished a master's degree in public health. Currently, she is working in the city government of Baguio as the head of the City Epidemiology and Surveillance Unit. She is also the program coordinator for the tobacco control, dengue control, and tuberculosis prevention and control programs. Here to present the elements of comprehensive smoke-free policy, ladies and gentlemen, please welcome Dr. Donabel Panes of Baguio City, Philippines. Over to you, Dr. Panes.
Thank you, Dr. Ferds. Good morning, fellow advocates, policymakers, and world changers. And I would like to thank the organizers of this 13th Asia Pacific Conference on Tobacco or Health and the Southeast Asia Tobacco Control Alliance and the Smoke-Free Cities in the Asia Pacific Network for the privilege to deliver a presentation on the elements of a comprehensive smoke-free policy, the Baguio City Experience. It is a pleasure to be sharing our experiences and best practices before an international audience. This presentation provides a quick guide on how urban areas like the Philippines, like Baguio City, can implement effectively a smoke-free policy in the midst of challenging times. Our city, Baguio City, is relatively small landlocked city where the land area of 57.49 kilometers located on the plateau on the mountains of the Cordillera has an average elevation of 1,540 meters above sea level. As of 2020, we have a population of 374,551 with a growth rate of 1.54% annually and a population density of 6,386 persons per square kilometer. It is the only highly urbanized city in the northern part of Luzon, and being so, it is the center of regional and local administration, education, health services, trade and industry, the summer capital of the Philippines. Guided with the city's smoke-free task force vision, which is to be a global model in smoke-free and healthy environment, in behalf of the members of the smoke-free task force, we are here to showcase our humble offering to the world. It was in 1966, 2 years after the U.S. Surgeon General released a document on the harms of tobacco, our chartered city approved its first smoke-free environment policies. It was a work in progress, from theaters, movie houses, taxis and garages, assembly halls, corridors, government offices, restaurants, and eateries, with a fine of 50 cents to $10 for any violation. The smoke-free environmental policies are also incorporated in the codified child and welfare and environmental policies of the city. But it was in 2017 when the FCTC, or the Framework Convention on Tobacco Control Compliant Ordinance, was passed. It has the following provisions: smoke-free environment, a comprehensive ban on tobacco advertising, promotion, and sponsorship, access restrictions, smoke cessation, tobacco industry interference, a structure, financing, and monitoring and evaluation component. 2 years after its approval, we saw a significant decrease of our smoking prevalence from among our adults 34% in 2016 to 17% in 2019, and among our youth 28% before the ordinance was passed and 12% in 2019, 2 years after its passage. And what were the elements of a smoke-free policy that would probably make it work in a highly urbanized city? This is spelled in 3 P's for a successful smoke-free policy below. First is that the product. The product has to be blatantly mentioned, and it should regulate or ban. Secondly, the approach, the service provisions, at what level, and its target individual or population. Thirdly is the perspective, the capacity to view things in their true relations, which will be discussed in the succeeding slides. Let's discuss the elements. The product. A good smoke-free policy should spell out the product it has to regulate, not just the current products in the market, but also should look at prospectively the product the tobacco industry intends to produce, create, innovate in the future. Cigarette, chewed tobacco, electronic devices, heated tobacco products, including unforeseen products, should be mentioned in the policy. Scientific evidence shows that tobacco company marketing strategies influences young people to start using tobacco. And with the advent of e-commerce, a good ordinance and policy has to consider all these marketing strategies and should prohibit, if not ban them at all. Our national leader, local leader has sent a very strong signal. The second P is on the element. P on the element is approach. Approach is discussed as a service delivery which a policy would deliver. The first one is preventive. Preventive means creating a smoke-free environment, an access restriction to vape and smoking, including prohibitions of selling by the stick, and a comprehensive ban on tobacco advertising, promotion, and sponsorship, including prohibitions of display. For the curative, medical management of nicotine addiction, as well as non-pharmacological intervention through smoke cessation counseling has to be spelled out. In the reintegrative part on the population-based reintegration, it means incorporating tobacco control program in other health programs existing in the city. And at the individual level, it includes social reintegration, a part of any substance disorder. Smoke cessation here, as you can see, is a curative approach. And on this slide, health promotion both as a preventive and a reintegrative approach. Target. A smoke-free policy should both be targeting in individuals in terms of clinical management like smoke cessation counseling, including nicotine replacement therapy, and population-based through effective and strategic communication. From dangers of smoking and vaping to tobacco industry interference, communication and information dissemination to the entire community, from the executive and legislative levels to the LGU, to the leaders at the barangays or villages, and to every citizen, had always been a paramount objective. We have established and still are exploiting effective platforms of communication, as it is imperative that information is brought down to people at all times. In 2020 alone, we have the highest social media reach at 1.091 million. Perspective, the third P, systems perspective, that is. Systems perspective zeroes in on how the different parts of a system interrelate and how systems will work within the context of a larger system. And systems thinking would connect its elements together to address a system issue, and leadership would be very, very critical. The first element on the systems perspective is the structure. A structure is a valuable tool in achieving coordination, as it specifies reporting relationships, who reports to whom, and it delineates formal communication channels. And it describes how separate actions of individuals are linked together. Financing involves the fund generation, mobilization, and allocation of resources. And lastly, the information system, which involves monitoring violations and compliance with the ordinance. This is the smoke-free task force structure, the command and control. The command and control is the means by which a commander or the local chief executive recognizes what needs to be done more and sees to it that appropriate actions are taken. The goal here is to sustain the gains and make sure it will be passed on at all levels of governance, from the task force to the community smoke-free task force, where majority of the enforcement are seen, and which you can appreciate later on as Sir Inigo will be presenting that to us later on. And data is the new gold, and we have designed a system responsive to the needs of the task force through systems development and evidence-based decision-making. We believe that a more granular data-driven understanding of individuals and communities in a complex natural ecosystem can open new possibilities of well-being. Just as gasoline fuels the task force, The fines we have collected, averaging $45,000 in annual collection, all will be allocated to the operations of the task force and the tobacco control program in the city. The pandemic may have set back some of our initiatives, but it has made our resolve clearer that this event is definitely a challenge, but more of an opportunity for for a sustainable future. A new normal where what we have started out to attain still remains to be clear-cut goal, but it is improving through the learnings that we have from this pandemic. We never regretted creating an environment through policy intervention, a smoke-free city that is, which can mitigate the impact of the pandemic in the long run. These elements, guided by the FCTC, supported by systems thinking leadership. The COVID-19 crisis and the political, economic, and social disruptions it has caused is fundamentally changing the traditional context of decision-making. The inconsistencies, inadequacies, and contradictions of multiple systems, from health, financial, to energy and education, are more exposed than ever amidst a global context of concern for lives and livelihoods. Leaders now find themselves at historic crossroads, managing short-term pressures against medium and long-term uncertainties. Amidst this, we can predict our future. And the only way to predict our future is to create it. We have created an environment our future generation would thank us for. And this is the call of times. Maraming salamat. Kapkun ka.
Thank you very much, Dr. Donna Tobera Panes, introducing us to the policies. So if you have any questions on smoke-free policies, kindly just write your questions in there's a Q&A box somewhere there in your screen on the left side down portion. So we will have the open forum later. So that was a very good presentation on policies. So we will go to the next speaker, move to the next speaker for this symposium on smoke-free. So our next speaker will be able to share to us a good model for enforcement of smoke-free laws. He finished his master's degree in public governance and was interested in tobacco control issues after joining the Johns Hopkins Global Tobacco Control Institute leadership training. Presently, he is working as the executive director of the Iloilo City Anti-Smoking Task Force and is also the officer in charge, head of the Agri-Fisheries Department of the City Government of Iloilo, Philippines. To talk on enforcement, the key to a sustainable smoke-free campaign, let's all welcome Mr. Inigo Garingalao. Over to you.
Good morning. Welcome to our presentation, the enforcement, the key to sustainable smoke-free campaigns. It all starts with the laws and ordinances, a comprehensive anti-smoking ordinance that has all the World Health Organization Framework Convention for Tobacco Control ingredients in it for a smoke-free place. The fines and the penalties should be clearly stated, as well as the roles of stakeholders and enforcers. Enforcing the ordinance will pave the way in amending the ordinance in the future opportunities. Lately, the Iloilo Council has passed another ordinance, amended it to address emerging tobacco products like the heated tobacco products. Enforcement needs the ordinance as its Bible. This slide shows the smoke-free meter as mentioned by Doc Doms, and it shows the blue areas that are smoke-free in the city of Iloilo, meaning anywhere on these areas that you are caught violating or putting up advertisements on tobacco, you will be fined. Those are the prohibited acts: conventional cigarettes usage and selling on non-designated areas, other ways of taking in tobacco products like the shisha, the electronic cigarette, and the heated tobacco products, as well as tobacco advertisements, promotions, and sponsorships or taps. Together with that, fines and penalties. These are the things that an enforcer should inculcate in his mind, should in fact memorize. We have in the screen the fines and penalties graduated into three: first, second, and third offense. And as you can see, it has an imprisonment clause. Likewise, the business establishments who tolerate smoking may be also advertisements, risk having their licenses revoked if with continuous violations. A person who gets caught or apprehended will be given a citation ticket, advised to pay within 3 days in the city treasurer's office, and if the person fails to do that, a case will be filed against him. He will be summoned by the court, and if he again doesn't do or pay, a warrant of arrest will be issued for him, and he will be arrested anywhere in the Philippines. Enforcement needs organization. And in here, as you can see the screen, we have the mayor as the chairperson, but the one who runs or does the day-to-day work is the executive director, and under him is the parallel advocacy work of awareness, the administration head who keeps the records on violators, processes the violators, and also we have the head of establishments and team leader for public vehicles and street operations. Of course, we recognize that many times we are just few in numbers. That is why it was encouraged to have collaborations for force multipliers. Force multipliers are groups or persons who volunteered and are like-minded in enforcing the anti-smoking ordinance. So in the screen, you can see the Guardians Brotherhood, who are retired policemen who can still do work for the city, the United Kif Ako, the Citizens Crime Watch, and of course the PNP, who are also mandated nationally to help in smoke-free enforcements. Yesterday, we remember that one of the things that Thailand also was underlining with all the ingredients of enforcement and awareness is political will, which is very, very important in enforcement. In Iloilo City, this political will created a task force concentrated only on anti-smoking and anti-vaping and emerging products. It has given stronger teeth with a one-strike policy, meaning if an establishment was inspected and has violations, readily their licenses are revoked and they are fined in the first offense. This political will also pushed for the approved amendment of electronic cigarette and heated tobacco products and included other nicotine delivery systems. And it also ordered the legal office to support the enforcers, because many times enforcers also get the cases filed against them by the tobacco industry or the earring violators or the violating establishments. So the enforcers have something to lean on. Our strategies: we do daily mobile enforcement, meaning we use vehicles, motorcycles and four-wheel vehicles at different times of the day and night with teams of 6 to 8 agents all over the city. And the schedule or the targets is being done early in the week and discussed before anything is done. All events will pass through ICA's office for orientation and eventual inspection. ICA's office is the smoke-free office. So it is inevitable that in a city there are concerts, parades, and events even during nighttime. And they get to process their permits in the city hall. And one of their stopping place for approval is the anti-smoking office, where they are oriented of how to make their event smoke-free and are scheduled for inspection for violations. Involved below enforcers, the police, and we enforce together or also enforce individually. The mayor also supported by creating a composite establishment night inspection team composed of the business licensing department, the anti-smoking group, the police, and a group on minors or youth going around at night. And the one-strike policy is being implemented, the closure and revocation of license whenever there is violations. We promote to smoke-free to nearby towns. Nearby towns and borders are usually places where the cigarette company put up their tobacco advertisements and promotions. So it is but prudent for us to mentor and to encourage neighboring towns to also adopt being smoke-free. The awareness campaign is ongoing and should run parallel with the enforcement. And we have the earned media credits wherein if what the task force is doing is newsworthy, we don't have to pay the media to spread what is happening in terms of anti-smoking. We continually train our enforcers, provide refreshers and specific mini trainings on handling unruly violators, on court legalities, and handling minors, and also ethics on work. On every operations, we provide briefings. We monitor that our people are actually doing what is right and what should be in our goals, as well as the ordinance. And we do debriefing sessions, especially when we have big operations. Of course, we provide relaxation activities, recognizing that enforcement is also attention field work. We adhere to the no deal with the cigarette company or any of its representatives, as well as the vape industry. And we adhere that our enforcers should not smoke and should not vape. In case of Iloilo City, if an enforcer does that, next day he will find himself out of work. So in the picture, you can see the enforcers doing their thing on village stores. who were tolerating or allowing a cigarette company to put up their advertisements and drop boxes. And those stores were fined $100 on the first offense and warned that if they again allow that, they will be closed for business. In the screen, you can see the enforcement in a big cockpit coliseum, a hard place to enforce, the public place, streets, and public utility vehicles versus drivers who are smoking. The night implementation and enforcement is very different from enforcement during daytime. And we have become adept in doing it, that even the event organizers took to putting their signages on their lead screens upon the risk of being closed or fined on their events. We do parallel smoke-free initiatives and activities for awareness. In the screen, you can see the police in their police community relations department doing a program designed by the task force, by the smoke-free task force. This program is called KISS, or Kids Smoke-Free Storytelling Program. We would want a generation who knows how to say no to vaping and smoking and could advise their parents not to smoke and expose them to secondhand smoke. COVID-19 pandemic brought some changes in enforcement, and we coupled that with virtual youth activities targeted to the 180 villages of the city of Iloilo. Of course, health protocols are strictly followed, and the message of no smoking, no vaping for strong lung and immune system is repeatedly pushed through social and traditional media, as well as it has become the punchline of the mayor. And we also underline the characteristic of the virus that is airborne, especially the Delta virus. We are also called to be vigilant against the corporate social responsibility gifts of the cigarette companies who are taking advantage of the vulnerability of the local government units whenever there are lockdowns. And of course, we have fought the lobby of the vapers group. That is why we passed the new ordinance. So in the screen, again, you can see enforcement in the streets wherein the agent is completely protected on a possible positive violator. The enforcement versus tobacco advertisements and promotions in the villages, and the continuous establishment inspections. At the risk of being redundant, we need the mayor's involvement. We need political will. And in the picture, you can see that the mayor is stating that he is pleased with the efforts of all stakeholders and local leaders, because these initiatives and this continuous and sustained work will reverberate beyond our time. So my advice for you as you go on with your enforcement work is, whatever you do, move on, learn, then move on some more. Thank you very much.
Thank you, Mr. Garingalao. That was a very interesting presentation. Just a gentle reminder that if you have questions to any of the speakers, kindly post them in the chat box. These questions will be addressed after the conclusion of all of the speakers. Now, moving on. Our third speaker is from Thailand. She has finished a master's degree in public health and specializes in local health management. She is presently the Director of Public Health Services of the Mahasarakam municipality in Thailand. To share their strategies to promote a smoke-free campaign, please welcome Mrs. Natia Yumtaisong. Over to you, Madam.
Okay, thank you, Dr. Ferdinand. Good morning. Nice to you, everybody, in the presentation today. I'm here to present you about our project, strategy to promote a smoke-free campaign. I will on to vision of Mahasarakham Town Municipality, quality organization, outstanding education, diversity, and happy society. Mahasarakham Town Municipality as Mahasarakham Province, Northeastern region of Thailand. Total population in 2020 about 51,000. The problem, smoking is major health problem in Thailand, same as Mahasarakham. People are harmed by cigarette smoke. Mahasarakham Province has an 18 smoking rate. The smoking rate in Mahasarakham Town Municipality area was 15.4%. However, the number of new smokers tend to increase. Project objectives: first, to reduce smoking rates in Mahasarakham Municipality area. Second, to create a tobacco control mechanism in the Mahasarakham Municipality area. Third, to raise awareness about the dangers of tobacco and be informed of tobacco industry tactics, particularly to getting the youth. Fourth, to create a smoke-free environment in compliance with the law. Fifth, to help smokers quit smoking. Operation of Mahasarakham Municipality Non-Smoking City from 2015 to 2020, 3-5 years target, reduce the rate of illness and death from smoking. Objective: to reduce smoking rates of people in the municipality and to reduce the smoking rate of young people. We have 5 strategies. 1. Build a mechanism, establish tobacco control mechanism, data system, monitoring, environment. 2. Manpower development manpower in the tobacco control from personal health promoter center. 3. Raise awareness about danger, study of media, campaign, prototype, tradition. 4. Create smoke-free environment, surveillance, law enforcement. 5. Helping to quit smoking. Then, build a mechanism, organize the community to make a memorandum of understanding, workshop for law drafting community, working group, public policy announcements of Mahasarakham City to notify that Mahasarakham Town Municipality is a smoke-free area according to the Tobacco Product Control Act. Public relations through community radio stations. Conduct a survey on the perception of people. This is public relations through newspaper, daily news. Manpower development. Train target groups consisting of teachers, youth, and students. Organize training activities to increase the skills of people in the community in implementing smoke-free community activities, such as community leaders, quitting smoking, surveillance leaders. Set up the working group to monitor the operations of the leaders. Conduct the surveillance based on the Tobacco Product Control Act. Award certificates to smoke-free readers. Raising awareness. Create a community-based smoke-free plan. Organize a meeting to create and announce the public policy of Mahasarakham Town Municipality to be a smoke-free area. Organize regular meeting of smoke-free community working group. Conduct road public relations activities using budget of agency or from private sector in the area. Creating a smoke-free environment. Make on public place smoke-free with the support of owners of establishments. Post no smoking sign in all smoke-free public place. Invite family in communities to support a smoke-free home. This is smoke-free place, bus stop, temple, bus station, health park, school, accommodations. How to quiz, explore local cigarette data and development data in October 2020. Organize a smoking cessation clinic service units in 5 community health centers and network drugstores such as Mahasarakham University Pharmacy to change the behavior of smokers and help them quit smoking. Provide proactive smoking cessation service with support from the community health center. Make home visits to follow up with smoking. Receive the proactive smoking cessation service. We have network partners, Recon Surveillance Network, Smoking Cessation Network, Public Relations Network, surveillance network to prevent new smokers. Obstacle smoker attitude towards smoking. It's not found that smoking is acceptable in male child, adolescent, and influenced by friends or family members to socialize and reduce stress, which is an effect of media advertising. Second, family member is close friends, play an important role in the smoking behavior of adolescents. Third, enforcement of tobacco control law skill week. Fourth, after follow-up visit, it was found that the clients were not ready and willing to stop smoking. Project sustainability. First, search for smokers and encourage them to reduce and quit smoking, including implementing the smoking cessation program in education institutions to treat new smokers. Second, your model is reduce and quit smoking community. Third, establish a smoking cessation clinic to be an alternative health service from the people. Fourth, promote participation of network partners, both public and private and civil society sectors, to encourage cooperation in compliance with the Tobacco Product Control Act. Then I will end presentation right now. Thank you.
Thank you very much, Ms. Natia, for that very informative presentation. So let's move on to our fourth speaker. She studied Bachelor of Science in Business Administration, but presently serves the people of the municipality of Binalupihan in the Philippines as the municipal mayor. She was also elected as the president of the Smoke-Free Cities Asia Pacific Network, or SCAN, the Philippine chapter, and the regional network. Ladies and gentlemen, here to talk about empowering the youth for a smoke-free future, may I present to you Mayor Angela S. Garcia. Here.
morning to everyone. I'd like to thank you for the opportunity to be a resource person in this virtual 13th Asia Pacific Conference on Tobacco and Health. Let me share our experience in empowering the youth for a smoke-free future. Firstly, we have to acknowledge that there is a problem. Tobacco kills 8 million people worldwide every year. Over 1 million tobacco-related deaths are due to secondhand smoke exposure. For decades, the tobacco industry has purposely used aggressive tactics to lure the youth to tobacco and nicotine products. But the secret is out. If a product kills 8 million people each year, the manufacturers will need to target a new generation. In 2020, the new WHO campaign was on the tobacco-free generation. It provides young people with the knowledge required to easily detect industry manipulation and equip them with the tools to rebuff such tactics, thereby empowering young people to stand up against them. For decades, the tobacco industry has deliberately employed strategic, aggressive, and well-resourced tactics to attract youth to tobacco and nicotine products. Internal industry documents reveal in-depth research and calculated approaches designed to attract a new generation of tobacco users, from product design to marketing campaigns aimed at replacing the millions of people who die each year from tobacco attributable diseases with new consumers or replacement smokers, and this is our youth. According to WHO, at least 43 million adolescents aged 13 to 15 used tobacco in 2018 globally. Adolescents who smoke are more likely to suffer chronic respiratory disorders and risk permanently damaging their lungs. The tobacco industry specifically targets the youth to create a new generation of nicotine addicts. And recent studies show that smokers have a higher risk for a severe case of COVID-19. So what is our response to this tobacco epidemic? Youth empowerment. Youth empowerment is done through the direct involvement and engagement of youth in tobacco control. There is a need to call upon the youth to join the fight to create a smoke-free and a tobacco-free generation. We would like to introduce Tobacco-Free Generation Pilipinas. TFG Pilipinas aims to promote awareness and encourage teens to be the generation that makes a difference. The Tobacco-Free Generation movement was launched in the province of Bataan in 2016. First in Balanga City as the first city worldwide, then in the municipality of Dinalupihan as the first municipality worldwide, and it spread to other municipalities in the province of Bataan. This was in collaboration with TFGI Singapore, headed by Dr. Heng Nung Kung. It encourages the youth of the new millennium to become part of educational campaigns to prevent them from becoming replacement smokers and create a tobacco-free generation. And the TFG movement has spread from Bataan to Manila. We have visited TFG Manila Mayor Isko Moreno. Of course, how do we empower the youth? Youth empowerment is achieved through program development. We have to meet with smoke-free advocates, school officials, and adult mentors to gauge interest in tobacco control. We have to identify adult champions of tobacco control. We have to conduct empowerment training to change attitudes, beliefs, and knowledge of tobacco products and tobacco use. We have to conduct skills building for the tobacco-free advocacy, encourage the youth to conduct tobacco assessment in their community to identify areas of strength and what needs to be addressed. Youth empowerment is achieved through training. We conducted trainings that provide adequate information on tobacco use and its harms, tobacco industry tactics targeting the youth, and local tobacco laws. We included e-cigarette education in such trainings, and we give relevant examples and photos that resonate with the youth and reiterate how influential the tobacco industry is. And of course, we have to assess what we have done with our programs. So we have to assess the youth's tobacco control attitudes by asking them if they support laws that prohibit selling tobacco to minors. We have to gauge perception of the efficacy of their advocacy as to how they can influence the way adults in their community feel about tobacco and how they can reduce tobacco use. We have to find out how confident our youth is in their ability to convince others not to use tobacco. We have to ask them how sure they are that they can convince family members not to smoke or use tobacco. And in all our trainings, of course, we ask them questions and we do a metrics. And based on questions 1, 2, 3, 4, and 5, we can see that from this birth year 2006-2007, in 2019, they were 12 and 13-year-olds. There is a positive response to tobacco control. And lastly, youth empowerment through advocacy. Our youth has a powerful voice. Advocacy for tobacco control with our students, family members, or friends, and institutions about the harms of tobacco use to the health and to the environment. So we have peer facilitators among youth explaining to them what we have done. They are also part of our Adolescent Health and Development Program, and they are part of the National Youth Commission. And TFG is also an advocate for policy change. So from representing the youth in Syntax Coalition in Senate and as a youth initiative Congress partner organization. And in all this, we have to say that we build critical partnerships. And critical partnerships with LGUs, with civil service organizations, with national agencies, and especially the Department of Education. But the experience has been successful because of DepEd 100% support. We were able to tap Supreme student governments through DepEd and go to the 100% of the all secondary schools in the province of Bataan. And this is not only happening in the Philippines. This is happening in other countries like Thailand, where there is also a strong youth empowerment. Thailand has a Gen Z, Gen Strong, No Smoking campaign where they build capacity of the youth. The target youth group is aged 7 to 20 years old and older, which is Gen Z, and the campaign gives youth opportunities to participate in non-smoking advocacy activities. The capacity build process will be provided to them until they have comprehensive knowledge to carry out activities and collectively drive policies to control tobacco consumption. It is believed that if the youth enter such a process, they will not be fooled by the tobacco industry tactics and can decide not to smoke. Also in Singapore, where TFG or Tobacco Free Generation started, it is a social movement that seeks to rebalance the landscape of teenage smoking. TFG Singapore has a big part in TFG Bataan. And on behalf of TFG Pilipinas, I would like to thank all of you for not smoking. Back to you, Dr. Doms.
Thank you, Mayor Garcia. That was an engaging presentation. I am certain that everyone here has gained insights on creating a tobacco-free or smoke-free generation through youth empowerment. So thank you very much, Mayor Garcia. For our last speaker, she is very familiar to all of you and good friends to most of you. For today, our last speaker is a doctor of medicine, a family physician, a registered medical technologist, and has a master's degree in community health. She is currently the Smoke-Free Program Manager of the Southeast Asia Tobacco Control Alliance, or SIATCA. She is also the Regional Coordinator of the Framework on Convention Alliance in the Western Pacific region. She is also the Secretary General of the Smoke-Free Cities Asia Pacific Network, or SCAN, and is also the Secretariat of the Smoke-Free Heritage Sites and Cities Alliance. To share with us and teach us how to use the smoke-free meter, your guide and gauge in making a city smoke-free, please give a warm round of applause to my co-moderator and colleague and good friend, Dr. Domalyn Villares, or Dr. Doms.
Thank you very much, Dr. Ferdy. So virtual applause for all of us. So after the title of my presentation is the smoke-free meter, your guide and gauge in making your city smoke-free. So this is not about cities only. It depends on where you are. So municipality, the province, the state, or the region. So after our speakers presented their experiences in their own cities and municipalities, I will share with you the smoke-free meter. We call it the smoke-free meter. It is a guide for those who would like to make a particular area smoke-free, and a gauge for those that are already doing smoke-free. So this is based on the experience of the different cities, smoke-free cities in the ASEAN region. And we are using a simple acronym that will be easy for you to remember, and it is STOP Smoking. It is comprehensive, and it can be used to improve the implementation of your smoke-free law. So we received a question from Kun Sirinan Tang Yusok. He was asking about what is the key to sustainable smoke-free cities. So this is the answer to your question, the key elements of a smoke-free city campaign. So the acronym STOP refers to the policies, the laws, the regulations. So the first S would be the smoke-free enclosed places and public outdoor spaces. T would be the task force or the enforcement team or the working group. And O will refer to the organizations, the civil societies, and P would be the political will, meaning the head of your city, municipality, or if it is a workplace, the head of the workplace. So you can use this also for hotels and restaurants. The second word, smoking, refers to enforcement and implementation. So the first S, the second S would be on the strategies, the activities. So this will differ in different cities and municipalities, not the same. M would be the mass media campaign. O would be outdoor advertisements. So we have to remove the advertisements of the tobacco companies. And so we replace the advertisements of the tobacco companies with key messages on tobacco control. I would be implementation and inspection. And N is very important on Article 5.3 of the FCTC, never negotiate with the tobacco industry. So with the upcoming devices, electronic devices with nicotine, I think we have to include the nicotine industry also here. And lastly, G would be government support. It can be funding, it can be in other support that the government can give to your campaign. I will not be discussing all these key elements or indicators. We can have a separate discussion on this because it's very long. But our focus for today is about the smoke-free meter. And you can see here the acronym and the key elements, including the ribbon. So this is something to do with how the ribbon will look in your particular city or municipality. So let's just take some examples. The first one would indicator or key element is about the smoke-free and closed places and public outdoor spaces. And this is the first thing that you have to do is to determine which places in your city or municipality is smoke-free. So in the first column would be the places, the settings, and I am using here the countries in the ASEAN, the 10 countries. So we have Brunei, Cambodia, Indonesia, Laos, Malaysia, Myanmar, Philippines, Singapore, Thailand, and Vietnam. So you will see the all blues are 100% smoke-free in the places mentioned in the first column. The yellow ones are those having the smoking rooms indoor. And the third one, which is on the red color, means it's not in their law. Okay? So let's cite an example first. So we have mentioned also in the first speaker, Dr. Panes, regarding the policies, your legislation. It is very important to know the key elements in making a good legislation, the scope or the coverage, the definition of terms is very important, the prohibited acts and persons liable, duty of compliance, enforcement team discussed by our second speaker, Mr. Garingalao, penalties and fines, very important. So you have to make sure that you have included that into your law, public complaint and funding. So penalties, as discussed by Mr. Garingalao, should be larger penalties required to deter business violators and should increase for repeated violations. So going to the smoke-free and closed places, the blue color means 100% smoke-free in the city. So there should be no smoking room indoors. The yellow color allows the smoking rooms indoors, and the red, it means it's not in your regulation. Okay, so looking into the first indicator, you have to color it blue, okay, because you don't have smoking rooms indoors. Okay, citing another example, the second indicator, task force or the enforcement team or the working group. So your enforcement team, you should prepare also your enforcement mechanism. The enforcers can be, you organize your own task force. You can use your health inspectors also, or the sanitation inspectors, and you can also have volunteers coming from the government or from the civil society group. So it's very important to include the NGOs that are not connected with the tobacco industry. So this was discussed very comprehensively. And referring to the task force or the working group, you will have to place blue color if your city has a task force or a working group strongly enforcing the law. So even if you have the task force in your law, but they are not implementing, they are not enforcing, they are not going out to check for violations, you don't give a blue color. It's just a yellow color. So the city has a task force, but they are not enforcing regularly. So the red color means the city has no enforcement team or working group. So the color would be like this. Okay, so you place yellow color in your task force. So you would have to continue all these indicators. There are corresponding colors for what level you are into. And so if you're not 100% smoke-free, or you don't have the support of the NGOs, so your ribbon will look like this. Different colors, yellow, red, and blue. Okay? And after that, for those in the advanced implementation of smoke-free policy, they will have the blue ribbon, which is also being supported by the World Health Organization in WIPRO, the Blue Ribbon Campaign. Okay? So please make sure that you are moving in towards making a blue ribbon, not a red ribbon or a yellow ribbon. So after this symposium, you can go and check the smoke-free toolkit. You will be guided on how to make the respond to the smoke-free toolkit, and make sure that you will be making your city or municipality 100% smoke-free. So we will be, after this, part of the APACT resolution on smoke-free. I hope you will support the resolution that we have to call our governments to adopt, strengthen, and sustain the implementation of 100% smoke-free policies in all enclosed workplaces, public places, and public transportation, covering all forms of tobacco products, including water pipes and the electronic smoking devices. So we are calling for all those in the cities, municipalities, provinces, states, and regions. This is not only for the cities. We are enjoining you to join the Smoke-Free Cities Asia Pacific Network, or SCAN. And if you have anything to ask for information on SCAN and smoke-free, you can like us on our Facebook and ask your questions there, or you can email us directly at scan-secretariat at siatka.org. So thank you very much for joining our symposium this morning. Can we have all our speakers? Video on. Okay, I have to stop screen share. Okay, so we have to go into the questions. Okay, video on please for all our speakers, so we can also have our group photo. Mayor Garcia. Okay. So let me ask the first question. Dr. Ferdy, do you have any questions for our speakers? I think we have to read first the first question that we have. How to Mr. Garingalao, how was the enforcement done during the pandemic?
It is a challenge, no? As when we enforce, a violator may be positive. So we were very strict with the health protocols for our enforcers: face masks, face shields, disinfect the vehicle going out and going in, and of course they are told to take off all their clothes and bath when they reach their homes. And any enforcer that has flu-like symptoms is not allowed to join the team. And of course, we coupled enforcement with the virtual awareness to the youth. We do activities that are Instagrammable or could be placed in the social media, and we make use intensively also of the traditional media like radio and TV for awareness purposes. And we studied how we can we read about how COVID-19 and smoking are related, and we dwelled on that. So careful is and be safe is the norm when enforcing during pandemic.
Thank you. So, Dr. Ferdy, can you see the questions on the chat box?
Yes, Doms. Before the questions, again, thank you, Doms, for your presentation.
Thank you.
He immediately went to the question and answer, but then thank you very much for
Yeah.
a very interesting presentation, particularly sharing the tools and indicators to in moving towards a smoke-free environment. There's a question in the chat box with regard to that is timely as well. Any of the speakers can respond to this. The question is from Priska Maya Putri. Can you give some solutions for campaign or speaking up or advocacy about tobacco control in the pandemic, during this pandemic?
So probably Dr. Donna can respond to that, tobacco control and during the COVID-19 pandemic.
Yeah. Thank you for the question. No, this became real to us when we did a contact tracing of our cases, and based on the result of the contact tracing, we traced back the source in a smoking area, a designated smoking area, and through that, we were able to use it to close the designated smoking area of that particular establishment or office, to include already others. So it was an opportunity for us to do some more regulatory functions with regards to COVID-19. So I think that would be a good one. Make sure that your contact tracers are functioning well. In that way, you can come up with a more granular decision-making process, and use this use this for tobacco control. Like sabi ko nga, that's what I mentioned kanina a while ago. It's the closure of the DSA very important. Secondly, well, most people are already inside homes, working from home. It was a dangerous thing for the children, also school from home. It has to, no, the policies, these are the missing in policies. How are we going to cover this homes to make it smoke-free? So I think that the question there is coming up with a solution for a smoke-free home, coming up with policies for a smoke-free home, because this would address this double na tayo, hitting the two birds with one stone, tobacco control and COVID-19 as well.
Yeah, I have read an article this morning that there's a workplace in Japan that says that there should be no smoking even if you're working at home. So that is a very good initiative from that workplace. So I think the head of the workplaces can do that also, because people are working from their homes, and we have to make sure that the family are being protected from the second-hand smoke and the third-hand smoke while they are working at home. Do we have more questions, Dr. Ferd?
Yes, we do have. Probably Dr. Natia can also respond to this. Based on the presentation of Ms. Natia, basically it's government-driven as well, and the projects and programs that were presented earlier. The question is, how can we maintain the sustainability of these projects? Ms. Natia?
My projects have five strategy. Strategy 1, developing building, facility, personnel, public service system in accordance with good government principles. Strategy 2, promoting education, religion, culture, and creation. Strategy 5, developing and transportation and preserving natural resource and environment. Strategy 4, developing a happy society and promote public participation.
So yes, thank you very
Thank you.
much, Ms. Natia. I know that you will just continue what you are doing. Mayor Gila, we are about to close the session. It's already past 12 o'clock, but would you like to share or invite everyone to join the Smoke-Free Cities Asia Pacific Network as a closing?
Yes, of course. We would like to invite everybody, all organizations, both government, private, and civil service organizations who are with us now. We hope that we are all engaged and we are all supportive of our campaign against tobacco industry and campaign on tobacco control, including e-cigarettes. We hope that for the very tobacco-free generation, next generation, for a smoke-free future and a smoke-free home, we hope to solicit the 100% support of everybody. Thank you.
Okay, thank you very much, Mayor Gila. So as a closing, now that concludes our symposium today. We would like to thank everyone who joined this symposium, and if you have any questions, feel free to email us. We hope that all of you have gained invaluable learnings from the lectures presented, learnings that you can use to create a smoke-free environment in your communities. Thank you so much for joining Symposium 13. And Dr. Ferdy, last words?
Yes, thank you so much for having me here, and it was a pleasure to hear a lot of things from our distinguished speakers. Thank you.
Yeah, thank you for joining Dr. Ferdy, our moderator, and also our speakers. So thank you, everyone. Hope to see you again in the next APACT. So back to Dr. Nawarat for our next session. Thank you.
Thank you. Bye.
Bye.